Good afternoon. My name is Olivia, and I am here to tell you the easiest way you're going to pass the NCLEX with pharmacology questions. So, for the first rule I have, you need to focus on the drug class. Why, do you ask? Because you need to understand what the drug does and you need to understand the risks. So, let me give you a quick example. The suffix pril is from ACE inhibitor, correct? Correct. So you need to understand that it's an antihypertensive, and then you need to watch out for a dry cough and angioedema. Next rule, you need to learn the facts of the drug classes. So for example, ACE inhibitor, what I just said, the antihypertensive, it lowers the blood pressure, but watch out for dry cough and most importantly, swelling to the lips and the face. The medication should be stopped. The third rule I have for you is to remember the safety implications. When we're talking about digoxin, right? You need to hold it if the blood pressure is less. The BPM is less than 60, so beats per minute. Do not administer erectile dysfunction meds when you're giving nitroglycerin. Why? Because the blood pressure is going to drop and then risk. So we don't want that either. Another thing I would like you to remember are labs when it comes to certain medications, especially when we talk about diuretics. Watch out for potassium and sodium. Watch out for those. Then with certain other drug classes, like say insulin, know your onset and durations and what insulin you should give when you are going to feed, before you feed your patient. So which will be your quick acting, your fast acting. Know the insulins you're supposed to mix and RRN. And then also recognize which insulin you can give IV. So if you remember those steps that I just went over, you shouldn't have to remember all the meds. You really need to especially understand your high alert meds, and you should be fine. So hope that helps you. I will leave a link to 2 sources that can help you with medications and help with mostly visual learners on how to be able to get them to stick. Make a chart and be able to do recall, so that way it will be easier for you to help you when you're studying for the pharmacology. All right, have a good one. Thank you.